Hi, I'm Dr. Mirrafati from Mirrafati. Again, continuing our video series about what happened to the implant after 10 years. Again, number three in our list is not just after 10 years, but basically I keep repeating this, but there's a higher chance of it when you have an implant for 10 to 15 years that these top 6 things can happen. Now, number three in our list is the implant could be fine. There's no ruptures, no capsular contraction, but your own breast tissue basically changes. And there are a number of reasons. It could be pregnancy, post-pregnancies, weight fluctuation, gaining 20 pounds, losing 20 pounds. Aging skin, obviously as you age and you go through a pregnancy and weight fluctuation, your skin doesn't have that turgor anymore. And so the skin is not able to hold the breast tissue as well as the weight or the size of that implant. And again, the most common thing is gravity, because as you age and you put those implants in, they got certain weight on them, 400, 500, whatever it is not much, but it does have some weight on it. And obviously, most of the time you're standing up, so that gravity is also changing the contour of that breast tissue, hence that shape of that implant. And the last and final thing, obviously, is hormonal changes as you go through menopause and hormones changes, estrogen, progesterone, all that stuff changes the aging or the texture of the skin, and also the tissue or the breast tissue. As you age, from having more glandular breast tissue, it goes to a more fatty tissue, and fatty tissue is not a gland, so it's not holding the breast tissue together. So implant could be perfectly fine. There's no deflation if it's a saline implant, or there's no rupture of the implant. Obviously, your body didn't attack the implant. There's no capsular contraction, like putting a wall around that implant. But because of the different reasons, basically the shape of your implant changes. Now, does that happen every time you have pregnancy? No, it doesn't. There are a certain number of girls that really nothing happens. Or if you have a minor weight fluctuation, does it happen? Well, not really. If you're going up about 20, going down about 20, that's not too much of a weight fluctuation. But I guess the aging skin, you can't defy it. We're going to age no matter what. That skin's going to lose its turgidity and also the collagen formation in there. So it's just going to get more aging skin, and obviously you can't help the gravity, and hormonal changes is way up there. So if those things happen, then should you change it immediately? No, it's all aesthetic reason. And you did this for aesthetic reason. It's not like it's deflated and it looks weird. One is higher, one is bigger, one smaller, or deflated, or capsular contraction where you have pain, or if you have silicone in there, you have to get it out, which, by the way, with this new silicone, we covered it in the old video that you really don't have to rush and get it out, but you should be thinking about getting it out, and it's not an emergency, and don't let any of us get you to think, oh, I need to be moved out, immediately, and I'm the guy to do it. Now you have time, go to different doctors, see which one you like them to change your implant, and obviously pursue that doctor, because it is still considered aesthetic, and you should build a bond and connection with your doctor. And the hormonal changes, I mean, obviously, I'm a big advocate of, putting patient back on a hormone if they go through menopause. And there's a lot of great science behind hormone replacement therapy. So I advise it, but obviously talk to your primary care doctor about that as well. But in any situation, in basically change the shape of your body changing, and then hence the shape of the implant changing, is really not a medical emergency at all. If you like the implant, leave it. Now, what I actually tell my patient when they're in their 40s, I say, you know what? You have many more years to go. So why don't we just change the implant, make it look good, and take this next set of implant to your grave. However, if I have a patient who comes to me in their 70s and their implant deformed, but it's not capsular contraction, it's not ruptured, I tell them, you're 70, you don't have to change it. So let it go. There's no reason that I should expose you to an hour and a half time of surgery and you go through this replacement. but that's your lifestyle. So that's what I advise patients. If you're in the middle age group, I think it's a good idea to change it, because things are going to get shaped differently and it's just going to drop more, so the shape's going to get less attractive. So it is a good idea to change. Cost-wise, it's about 10 to 11,000 depending upon you doing saline or silicone, but I guess it varies to different doctor you go. That's how much I charge over here. So if you like these educational videos, go ahead and hit the subscribe button. Or you can always message me if you have any question, or if you guys want me to cover any other issues. I would love to do so. Stay healthy.